Malaria is a disease caused by a plasmodium parasite transmitted by the bite of infected mosquitoes. Medics say the severity of malaria varies based on the species of plasmodium. And as part of effort to address the challenges of malaria in Nigeria, civil society in malaria control, immunization and nutrition, ACOMIN, presented an update on projects and some achievements gathered so far.
Speaking to Clearview Television and other stakeholders in Minna, Niger State, the state coordinator, Mr. Kalejaye Olasukomi, said the civil society in malaria control and nutrition, ACOMIN, has been able to resolve issues such as stock out of drugs and long-lasting insecticide nets in some primary healthcare centers in the state. Mr. Kalejaye said resolving community conflicts that negatively affected uptake of service in global funding-supported healthcare centers, increasing awareness about prevention of malaria in several communities across the state are some of the achievements.
Civil Society in Malaria Control, Immunization and Nutrition, ACOMI, is the national network of civil society organizations working on the prevention, treatment and mitigation of impact of malaria as well as the promotion of immunization and better nutrition in Nigeria. ACOMI is a non-political, non-sectarian and non-profit organization working in collaboration with the government, partners and stakeholders both at national and state level.
Mr. Kalejaye said, despite the achievements, ACOMIN is faced with some challenges in malaria intervention in the state. He outlined these challenges as inadequate funding for malaria intervention by states and local governments, as well as insufficient human resources for health in most of the health facilities.
Some challenges still being faced in malaria intervention in the state are as follows. 1. We have inadequate funding for malaria intervention by state and local government. We realize that some of the budget allocation to malaria is not in fact, is not to write home about. And as we speak, local government they are not contributing their own budget. They are not budgeting for malaria intervention. So we still find it difficult for local government to assist the state in that area.
Mr. Kalejaye, however, pleaded with the state governments to increase budgetary allocation for malaria intervention in the state and the recruitment of more human resources for health in most of health facilities. He also charged local governments to have budgetary allocation for malaria.
One, the state government should increase budgetary allocation for malaria intervention in the state. We want like some of the activity is lumped. Malaria activity is lumped under public health. We want a place whereby malaria intervention project we have his own budget line, budget code that it can be budgeted for and for his own other interventions. Two, local government should have budgetary allocation for malaria. As just said, local government they rely solely on government. If government did not budget for malaria in their local government, they will not do so. So we want them to take ownership of malaria intervention in their local government. So they should budget some funds for the malaria intervention project. Third, the state government should recruit more human resources for health in most of the health facilities. You know, we are using your staff is generic across the state. It's not only some particular local government, it's all the states.
ACOMIN is a non-profit organization working in collaboration with government partners and stakeholders both at national and state levels.